thank you for the opportunity, Joe and Jim, to be here. I am representing the Hospital Quality Institute that I steward for the state of California. And it was formed in 2013 as a statewide organization to align, sustain, and create acceleration and impact in quality and safety across California. The two words that really stand out for me here is acceleration and impact. We've been at this a long time. And very often, part of our barriers are what has made us as parts very strong. But it's time to put them away, come together, collaborate, not worry about attribution of results, but achieve them together. And that's what HQI is all about having happen. So it was formed by the California Hospital Association and the 4 regional associations who wanted to make a difference in California. We have great work going on here, but wanted more. And so I'm here today and pleased to bring you the voice of commitment by the hospitals across California. A commitment to 0 preventable deaths by 2020 as part of the Patient Safety Movement Foundation. We're very pleased and privileged to be part of this. It's inspiring. We need inspiration periodically. This voice that I bring is over 400 hospitals strong. And we care for 3.4 million hospitalized patients a year. And if you've ever been in a hospital or worked in a hospital, you know what a very vulnerable place that is. So it's our intent to perfect the care that's given in hospitals, recognizing that there's all kinds of connections and continuum that we have to be cognizant of. So our commitments to you and our accountability is in 3 buckets today. The first is maternity care, the second sepsis, and the third is infection and harm in the hospitals. And I'll just mention a brief statement on each one of those. Before I do, we have been getting better at getting better. We've been working at this for about 3 years. We're getting results. Well, we've been working at it historically a long time, but programmatically statewide for 3 years. And we've demonstrated some very good results. And what's exciting to me is in the last year, our results have accelerated by 30%. So we're getting things done in a faster time frame and learning how to get better at getting better. So our first commitment is to eliminate preventable mortality and morbidity in maternity care. Childbirth is the #1 reason for admissions in our hospitals, and yet we don't do well on a broad global scale in our outcomes. In California, we deliver over 500,000 babies a year. Last year it was 502,023 babies. Now that's the 8th largest number of births in the United States annually. So we feel a real obligation to be really good at this. That's a lot of lives impacted. So our mortality rate is 9.2 per 100,000 births. And we have disparities. If I were an African-American woman having a baby, my risk would be 3-fold that of other racial and ethnic groups. That's not okay. We need to figure that out. The drivers of mortality are postpartum hemorrhage and preeclampsia. So those are the 2 areas we're going to be uniquely focused on. And we have wonderful partners. We have a strategic partnership with the California Quality Care Consortium, ACOG, a number of professional and improvement organizations that really provide the science, the mentors, and the measurement for us to move forward on this. So our pledge is this. Next year, we will save 924 lives of mothers. And in so doing, reduce risks to babies, keep families intact, and begin the journey for better health, because that's where it begins with moms and babies. We will also commit to having 100% of maternity hospitals in California ready to respond to OB emergencies, the two that I mentioned. There are playbooks and guidelines, training, and emergency carts that will be prepared and ready for all the clinicians and staff working in this area. And the other thing we'll do is stay the course in reducing early elective deliveries, because we know how important that is to our newborns. We reduced early elective deliveries in the last 2 years by 74%, and we're not going to stop until all our maternity centers are under 3%. That's commitment 1. Commitment 2, reduce death from sepsis. The California risk-adjusted rate of death from sepsis for our population, for every 1,000 in our population, is 5.87. And we have almost 39 million people living here. So that is a lot of deaths from sepsis. Are they all preventable? Well, we don't know. But we've got great researchers and minds and energy focused on this. We do know in our hospital population we have 3.4 million. That is an environment that we can really focus on. And our intent and our pledge is that next year we will save 3,999 lives. We could call it 4,000. Now, if we go beyond our hospital, which I never really stop, so we will, our opportunity is almost 17,000. So we want to keep that on the radar screen as a North Star. Now, to do this, we're going to have to convene and align and bring talent together. There are many, many bright lights out there. I was meeting with the Emergency Safety Foundation folks today, and we're finding ways that we can create synergies to really help with early detection and early goal-directed therapy. We will have and continue to work with our simulation that goes to the hospitals themselves so they can work within their own culture and their own environments, peer-to-peer meetings, and collaboratives focused on this topic. So that's commitment number 2. Our third commitment is to eliminate preventable harm. We eliminated harm in 10 categories, 7 of which we eliminated, we reduced by 40%. Others are hovering around 30. This related to about 8,700 harms prevented and $74 million saved for California, which pales in the effect that it has on people. And many of these harms are antecedent to hospital mortality as well. So we want to get upstream, be focusing on the drivers. Our pledge is to prevent another 8,000 harms next year and keep going because we're chasing zero. And until we get there, we won't be satisfied in doing so. So that's our commitment to the foundation and to you, and I look forward to being able to report back on our success. Thank you.